Welcome back. We are having our first conversation for the morning, and it's all about Wellness Week. We have representatives joining us to talk to us about what you can expect this week as it relates to the campaign. We are joined by Kathleen Azueta Cho, and she is the technical advisor for HECOPAB. Good morning. We are also joined by Alondra Izagiri, and she is the national consultant as it relates to non-communicable diseases for PAHO and the WHO. And on my far right is Dr. Karen Lewis-Bell. She is a representative from PAHO and the WHO. Good morning, ladies, and welcome. Thank you so much for joining us.
Good morning, and thanks for
having us.
So we are here to talk about Wellness Week and the campaign that is put forward by the Ministry of Health and Wellness. What can we expect, and why is it important for us to really shed light on wellness?
Okay, so we have a whole week of activities centered around wellness. We have our partners here this morning with us, the Pan American Health Organization, and we all have a wellness campaign ongoing. But for this week, we have under the theme, Your Health is My Health, we're looking at the bringing more awareness on promoting healthy behaviors, healthy lifestyle, and each day of the week we are prioritizing on an important component of wellness. So yesterday we had Mental Health Monday, which focuses on volunteering, extending gratitude, being kind. Today is Nutrition Tuesday, and we're focusing on healthy eating, promoting a balanced diet, staying away from the sugar-sweetened beverages. And tomorrow, Wednesday, is a focus on oral health, and again, avoiding substance use and tobacco, smoking, the harmful effects that can have on our oral health. Thursday, we're looking at prevention and taking care of, getting your numbers checked. Early detection helps to save lives, so that's Thursday. And on Friday, we finish off with physical health. Let's get moving, there are no buts, and getting physically active. But apart from that week, we have a countrywide healthy lifestyle caravan initiative that is focusing on bringing health to the communities, and that is being done in partnership with the Pan American Health Organization. And it's an initiative that, again, focuses on healthy promotion.
Okay. Before, I'd like to get a bit into the whole idea of the caravan. But first, let's delve back into the 5 days of this week. How are we promoting these different themes for the days? Are there activities planned? We're talking about social media campaigns, pop-up events. What will the days look like for the week?
So we have extended the invitation to both the private and the public sector. Getting the involvement from all these sectors is very important. We need everyone on board. Yes, the Ministry of Health and Wellness, it's our mandate, but I believe we could have a bigger impact with everyone's input. So the workplace setting is very important. We have a workplace wellness forum taking place today. Right after this, we're heading to that. And so we're bringing administrative officers, human resource directors to come on board to just find out a little bit of what they can do for employees. And we're touching on various topics. So we have managing stress at the workplace setting. We have promoting nutrition, healthy and balanced meals. We have, we're also looking at the data on non-communicable diseases and why it's important to bring health and wellness in the workplace setting. But in addition to that, we also have the different regions having their activities at their districts. So we have activities being planned with the schools, with the communities, and we have different stakeholders. We're trying to get the local authority involved as well. We have, apart from the Wellness Forum, a big soca-thon on Friday in Belmopan.
Like
And
soca?
a
Soca
soca.
music.
So you dance,
Okay,
walk
it's fitness.
to soca, right?
Yeah, oh, nice.
It's a
Like
good,
Zumba.
right. So we're trying to just get everyone still in that celebratory carnival mode and tying it to wellness.
Wow.
I want to bring in Alondra, because you're the national consultant as it relates to the non-communicable diseases portion of PAHO and WHO. Let's talk about exactly what Ms. Kathleen mentioned, which was tying in health and wellness and your role when it comes to NCDs.
Yeah. I think the important part here is to acknowledge that we are trying to create enabling environments in workplaces and in the communities to remove the factors that increase the incidence of NCDs. We know that the four main factors that contribute to NCDs is unhealthy eating, sedentary lifestyles where people don't do any type of physical activity, smoking, using tobacco, and we know the harmful use of tobacco use, and alcohol consumption. So it is important to create awareness on the harmful or the effects of doing these or having a lifestyle that is not healthy, and how this can affect our productivity at work, our health at home, with our families. So it is important to just create that environment for everyone to feel safe to adopt healthy lifestyle. So if at workplace I have like a wellness area, I know I can take a mental break. I can get up, I feel stressed, I can go to a wellness area, relax, breathe, take a 5-minute break, and then walk back into my work duties. So it's just about creating that healthy environment for everyone to be able to take advantage of.
How do we find that that's that one initiative there, a wellness space in the workplace? How do we find that improves the overall health or wellness of an employee? And is it an uphill battle to get employers to buy into such an idea?
We have had several wellness forums with the Ministry of Health, and we have received very good feedback. Personally, as an employee, I feel like I am being considered. I feel appreciated, and I feel that my emotions are valid. So being able to have a space like a wellness area, it makes me feel that my organization cares for me, and it gets involved in my overall well-being.
Allow me to ask just one last question in the wellness area. What does an ideal wellness area look like, or what should it look like? What should I have there? Coffee, some snacks,
A TV, a bed,
right? AC, I don't know.
A power nap room.
Right? What should a wellness area look like?
Okay, I will share what our wellness area has.
And this is at PAHO?
At PAHO, the
Okay.
Ministry of Country Office, we have a sofa bed, we have pillows, we have a sheet, we have curtains, so if we want to turn off the light, we can turn off the light. It has a door, so we can close the door. But you are encouraged, if other organizations, if you have the resources, you can include a TV, you can include a coffee machine. There are different things that you can include, but I feel with the bed and the pillow alone, if I have a headache, I can go and rest there. So it's just an area. It doesn't have to be anything fancy. It's just for the person to have a private space for themselves.
Just don't go missing for half the day.
Yeah, or take wellness days or wellness moments every day.
Right.
I mean, I definitely commend the Ministry of Health and Wellness for taking on this campaign, Wellness Week, but also PAHO and WHO for collaborating with the ministry. Dr. Karen Bell, let's include you in the conversation as it relates to the collaboration with the ministry and why it was important for PAHO and WHO to be a part of this campaign.
Well, for us at PAHO, we are very concerned that the non-communicable diseases causes significant illness and death in our region, and in fact globally. Some 40 million people die because of NCDs each year. And in the region of Latin America and the Caribbean, the region of the Americas, non-communicable diseases are the leading cause of death. So we're talking about hypertension, diabetes, strokes, other cardiovascular disorders, cancers. And for us, it is important for us to build the awareness, because health is primarily an individual responsibility. So although the Ministry of Health in any country has a responsibility to provide the services, accessing the services, adhering to the recommendations and the guidance, adhering to medication that may be given to you is really an individual responsibility. PAHO, as a technical cooperation agency, our primary partner is the Ministry of Health in any country. And it is our mandate to ensure that the health and well-being of all persons living in the region of the Americas can access health, can improve their well-being. And so certainly this was a no-brainer for us. It really is important to build the awareness. And as Alondra said, there are many risk factors that are in our control in terms of healthy eating, physical activity, avoiding tobacco use, you know, salt and sugar reduction in our consumption. You know, that's very important. And so this is why we are partnering with the Ministry of Health. And this is not just for this week.
Yeah.
And Wellness Week is a regional activity. It's taking place in all the countries, typically the third week of September. Some countries may do it a little earlier, a little later, but usually in September. But this is not just a Wellness Week activity. This is an all-year activity. So this is really part of us providing that support, because the non-communicable diseases causes a significant burden on the resources of the health sector, not just financial, but the human resources as well.
In the same vein of this being a year-round initiative, you'll forgive my pessimism a bit here, right? But when it comes to access to healthier food options, especially in marginalized communities, it poses a greater challenge, even when you consider the cost of certain goods, and when you consider the context of Belize and inflation, and so that's one challenge. And then a lot of times people, if you're being honest, turn to tobacco as a means for some sort of mental wellness. Though it's not the best option, it's one of the realities that we see in marginalized communities as well. So again, it must be an uphill battle. How do we, on one hand, encourage healthier eating, diet, exercise, staying away from the tobacco, but on the other hand, empathize with the cost and access to healthy foods?
So I think oftentimes there is a misconception that the marginalized are more at risk. Oftentimes they plant what they need to eat, and they're the ones who are eating the complex carbohydrates. They're the ones who may be eating more vegetables, and they're not as sedentary as others who live in the urban environments. If you look at the developed world, obesity is a big problem there, because we are driving everywhere to work. We're not walking. We're not working hard in the fields. And so, you know, sometimes genetics may play a role, but oftentimes the rural community are more active and they are eating more healthily. But for us, the important thing is building awareness, and that's what we're doing with the Healthy Lifestyle Caravan. It's building awareness for persons to understand that these activities pose a risk. And these are the risks that lead to the high blood pressure, the diabetes, the kidney disease. And it's really, you know, strong community engagement and communicating the risk. And part of that is just helping the community. Okay, what do you have? What is the best way to prepare it? So it's not that we're telling them that, you know, you have to go to the supermarkets and you have to buy all the expensive things. Part of the building awareness is looking at what people have and really engaging and teaching and sharing information on how best to prepare it. So you don't add extra salt at the table. You use garlic and onion and scallions to season your foods rather than the processed seasonings that have a lot of nitrates and salt, etc. So that's how we do it.
I love that a big part of the awareness the campaign is awareness, and that you're including young people in it as well.
Right.
Kathleen, let's talk about how you are going into the schools as well to have the conversation of wellness from young.
So it's good that you touch on young or younger population. As Dr. Bell was saying, obesity is a big concern, and right now we are looking at childhood obesity. And currently we have the Healthy Habits, Healthy Schools, Healthy Belize initiative. And we are currently working with 18 schools in the Belize district. These are 18 piloted schools. Eventually we plan on bringing that countrywide. So it's a phased-in approach campaign, and we are looking at sensitizing students, parents, teachers on the importance of healthy eating and staying away from sugar-sweetened beverages, but also help create that enabling environment that will help improve the productivity of students. It will lead to less absenteeism. It will lead to better grades and much improved performance in schools. So that is one way in which we're trying to reach our younger population. And you know, these are diseases that once we tackle them from a younger age, then we're avoiding greater challenges into adulthood. You know, we're trying to prevent physical disability. If you're looking at diabetes, you're trying to avoid getting that amputation. You're looking at getting more physically active to avoid high blood pressure, to avoid chronic kidney disease. So starting with the younger population is very important, and children go back home and they spread the message. I know I have my younger daughter, and she would say, you know, Mommy, we need to eat healthy. We're not drinking any juices. We're drinking water today. So it's bringing that type of awareness into schools, into the workplace settings, into communities. So we're trying to work with every audience that we could possibly reach when it comes to wellness and healthy eating and increased physical activity.
Is it alarming to find that these lessons on health and wellness aren't being traditionally taught in the homes, and that there's a need for this sort of campaign? I'm wondering if somewhere along the way we lost what it means to be healthy or to eat healthy, if with globalization and the introduction of all these foods we decided to do away with all of that.
I think that I wouldn't say that we have lost it along the way. Our grandparents, our great-grandparents lived healthily because that's what they knew.
Right.
But as the industrialized world spread, and we have all these processed foods
That are cheaper too.
Yeah.
some of them are cheaper. So as you know, this happened, then naturally, you know, persons would gravitate to them, etc. And with the disease conditions, you know, it's science. We learn more and more by doing research. And so we find out, you know, that tobacco is the #1 killer in the world. And, you know, so as we gather more information, then we impart it. And learning is a process. And certainly, you know, things are changing throughout the world. So I wouldn't necessarily say that we lost it along the way, but as we are going along the way and we are gathering more information, then it gives us, you know, the impetus to share this information with individuals. And it's human behavior. It takes a while to change. It takes convincing, and so it has to be an ongoing, consistent process.
What is the obesity rate in Belize, and how would you compare it to the region?
Well, if we look at the 2011 global school student profile for Belize, the prevalence among the age group 13 to 15 was 12.5%. But if we look at the region, you can say 1 out of 3 children are overweight or are obese. So it's really, the data is out there, it's showing, and it's older data, but with the changes in lifestyle, I mean, that number probably, the rate has increased. And this is one of the reasons why we need to start from a very younger age, the sensitization, the increased awareness, and, you know, simple tips on what to do, and helping people to understand, you know, the cost analysis if you're looking at preventative interventions versus long-term care. You know, we oftentimes see people asking for, you know, donations on, you know, medical expenses, and we have people on waiting lists for dialysis treatment. You know, if you look at that cost versus, you know, basic screening on getting to know your numbers for high blood pressure, your sugar level, getting a pap smear done, these are, you know, you would say more practical approaches that one can take, and it's an individual choice that you could, you know, do. Of course, you know, making the access sometimes for communities, and this is why we take opportunity to partner with agencies like PAHO, who are helping us to bring these services to those who need it the most.
I don't think we touched fully on the whole caravan initiative. So if we can talk a bit more about what's happening with the caravan, are we talking about a nationwide tour of sorts for health?
Yes, I'm very excited to speak about the caravan. The caravan is a health promotion initiative that started in September, but we have been planning for months before. And it has a major focus on rural communities countrywide. We are making stops at every district, including the islands. So in total, it's 8 events between now until November. We have done an assessment in collaboration with the Ministry of Health to identify what communities are needed these services, and we have major services like screening, vaccination. We have information on NCDs. We take games. It's not all about getting screenings and getting your health numbers. We also take games. We have really fun activities to engage people and to learn this information. So it's not just to oh yes, we're promoting physical activity. So we're engaging persons in a fun way. It's not just, oh, it's a boring talk. We're going to go and sit there and we're going to hear people talk. No, we are engaging people through fun games. And we have seen a very good turnout. I think the ministry can attest to that. We have been involved, public health nurses, community health workers, and we are just working together out there to take all these services for the communities.
So when you make a stop, the stop is for a group of communities from an area, or is for one particular village?
Yeah, so I'll add, in conversation with PAHO, we also took the advice of the regions. Okay. So we have 4 major regions, and they have a good idea on what the needs and health concerns are for some of the communities in their districts. So we looked at you'd say the community health profile. So if we see a lot of a higher prevalence of diabetes, hypertension in this community, then that's the community we're going to prioritize. Of course, there are other communities, but for this caravan, we're taking it to that community. So, you know, for example, tomorrow we have Carmelita Village in Orange Walk. And we will be out there with, you know, doctors, nurses. But the regions play a very important role because we're relying on their staff to help in providing the screening, in help in giving the educational talks. Because we have segments that focus on, you know, giving group education sessions. And so they're the nurses who are doing the pap smears. They're the people on the ground who are getting the messages out. We have community health workers who are doing home visits to just bring the message. Tomorrow we're gonna head to this community, come out, get the services done, come and take part in some fun activities. So the regions play an important role because they know their areas of greater need, and we rely on the health staff.
Yeah, what?
I
Go ahead.
I love the idea of the caravan because I believe, as you mentioned, Ms. Kathleen, that the region's health staff would be able to identify where the need is most. And it brought a question in my mind: is there a sort of cultural norm in certain parts of the districts or certain parts of the country as it relates to health and wellness? Certain ways that they carry out their lifestyle across the country. Would you say it's different in different parts of the country?
Yes, definitely. It's in the north, for example, we see a lot of the soft drink consumption, and if we look at the data around chronic kidney disease, we see that affecting a lot of the mestizo in the Orange Rock and Corozal district. In Toledo, we see a higher rate of stunting because while they're very good on their exclusive breastfeeding, when it comes to complementary breastfeeding from 6 months to 2 years, that's where we see a shortcoming. So definitely you will see different trends in the various districts. So we have to work with what their needs are and the challenges that they are facing.
All right. Well,
And I just wanted to add that in addition to looking at the community profile, I think it was important, that the Ministry of Health also, in collaboration with the regional authorities, selected communities that may not have had such readily access to health services. So they could be, where are we going in Toledo? I think Barranco. So, it's a little distance from Punta Gorda, and, so we tried to select communities that did not have as ready access to some of these services. And I do believe the community is very appreciative of us coming to them. They don't have to spend bus fare, etc., to come out. And the screening is also very important for them as well.
What I appreciate about the initiative is that we're going to the communities, healthcare workers, going to the communities to engage on prevention, because oftentimes we only see our healthcare workers when we're sick, or when we have an issue, when we need them, and that's at the healthcare facilities somewhere. But the tables are turned, where now we're saying, hey, we're coming to you before you have to come to us.
Excellent.
And I appreciate that.
And oftentimes when people seek health care, it's for a particular issue. I have a cold, I have a cut, I have, a toothache or something. So in this setting, it's a little bit more relaxed, so we can do the health promotion.
Wonderful.
Well, ladies, thank you guys so much for joining us, for sharing what we can expect for Wellness Week. Of course, as you mentioned, Doctor, that this is something beyond just 1 week. So we appreciate the information and we look forward to the campaign rollout as well.
Thank you.
Thank you very much.
Thank you.
Alrighty, we're going to take a break, and when we come back, it's all about World Contraception Day. Don't go away.